Alright, welcome to another episode of Ortho Made Simple case discussion. And today we have a case of shoulder pain where we will familiarize ourselves with the chronic pain framework. Okay, so the lead into such questions would be likely an X-ray. Alright, and here we have an X-ray of the right shoulder, both the AP as well as the axillary view. The most abnormal finding is that of osteoarthritic changes in the glenohumeral joint, as evidenced by the loss of joint space, both on the AP as well as the axillary view. Number two, no obvious loose bodies. I note there is a huge osteophyte here, all right, which is a goat-speared osteophyte, pathognomonic of shoulder osteoarthritis. I note there's subchondral sclerosis both on the humerus as well as the glenoid side, and no obvious subchondral cyst. The diagnosis here is of primary shoulder osteoarthritis. Now, in the history, I expect the patient to complain of mechanical pain. I'm going to take a history to look for that. I'm going to make sure there are no red flags of loss of weight, loss of appetite, making sure that there's no night pain. All right. And I want to know how much the patient is affected in terms of function, in terms of home, occupation, community, as well as recreation. I want to ask particularly if the patient has stiffness, unable to reach his or her undergarments at the back, or reaching for things could be a difficulty. I also want to ask for any weakness in the presence of concomitant rotator cuff tears. All right. So next, I will then examine the patient. Now, in this patient, when I examine, I expect to find that there is stiffness, which is defined by a global limitation of both passive and active range of motion. Number two, power may or may not be limited depending on the pain or whether there's any concomitant rotator cuff tears. If this is a pure primary shoulder OA, I expect the strength to be full. Next, in terms of the special test, I expect some kind of pain when doing the impingement test. All right, so I have the x-rays here. The acute management in this patient will be threefold. Number one, analgesia based on WHO ladder, that's pharmacological. Non-pharmacological means of treatment here will include lifestyle modifications as well as physiotherapy to help with range of motion as well as strengthening of the muscles to help with pain relief. If the pain is the main problem, intra-articular HNL injections could be considered. Now, next, advanced imaging could be done if the patient fails non-operative management and is keen to pursue surgical management. In this patient, both an MRI was done. Right, an MRI was done primarily to look for the presence of rotator cuff tears and perhaps to justify the need for a reverse total shoulder replacement. All right, so here is a walkthrough of the MRI scan.
Okay, so what you see here, right, is the coronal view, okay, and this is the axial view. So as I scroll through, I'm seeing the supraspinatus attached down to the greater tuberosity. You can see the full length of the supraspinatus, it is intact. There's no major tear, right? So on this view, this is the axial view. On the front, you can see the subscapularis, it is intact. At the back will be the infraspinatus, is also intact, okay? And you can see there's a lot of effusion within the joint. This empty space here, this is a T2 fat suppressed view, so there's a lot of effusion even in the axillary pouch over here. All right, so this is what you can see on the MRI. There's reduced joint space, especially inferiorly, and a huge osteophyte. Okay.
All right, so there's an MRI scan. We find the rotator cuff is intact. Next, we also do a CT scan for pre-op planning. You will appreciate that the definition of the bone is much sharper. This allows accurate measurement of the diameters and width of the glenoid and so on and so forth. All right, so let me run through the CT scan.
All right, so this is a CT scan, right? A CT scan is done for pre-op planning in the case of replacement surgery of the shoulder. So this is a coronal cut. You can see the huge osteophyte over here. Total loss of joint space with bone-on-bone articulation with subchondral sclerosis, right? As you scroll through, you can see really it's bone-on-bone articulation. Okay, appreciate that this is a CT scan, so you cannot see any of the muscles that attach down onto the greater tuberosity. Okay, this is an axial cut. You can see that again, bone-on-bone articulation. So the usefulness of this view is to allow us to do surgical planning, right? We can plan the size of the glenoid implant, we can plan the trajectory of the screws and so on and so forth. All right, so this is the utility of a CT scan. Okay, all right.
Fantastic. All right, so that was done. And eventually, the decision is for definitive management. If non-operative fails, which should be a replacement surgery. So, right, in this case, a reverse total shoulder arthroplasty was carried out. Right, so you can see the reverse relationship of the glenoid is now round, while the humerus is now convex. All right, so this is a reverse total shoulder replacement, both on the AP as well as a Valpue view. Right, post-operatively, there will be wound. The wound takes about 2 weeks to heal. There will definitely be prophylactic antibiotics prescribed to prevent infection. Okay, so this is a case of an osteoarthritis of the shoulder, right? Keywords in the history will be mechanical pain. Yeah, making sure there's no red flags. In the physical examination, we are looking for stiffness, right? And we have seen the rest of the boxes being applied in this case of a primary shoulder OA. If you have any other questions, feel free to drop me a text. Take care.